There are a few terms I want to drive home here, right? And they're very specific. I want to first talk about filtration, right? Anytime, so there's two environments again, right? Either you have the bloodstream or the nephron. If you happen to go from the glomerular capillaries to the Bowman's capsule, you're going from the bloodstream, which is the glomerulus or the glomerular capillary, right over here, and you go into the nephron. We have a name for that. We actually call this filtration. Number one. Now remember I told you the PTT is the site of reabsorption? Well, what are you doing? You're moving stuff from the kidneys. Remember I told you there's two environments. Either you have the kidney, the nephron. So it's going from the nephron and the kidney. Same difference. And it's going back into the bloodstream. We call that reabsorption. If you are going from the bloodstream into the nephron, and it's not the glomerulus, so this is not the glomerulus, it's the peritubular capillaries, right? Then we actually call this secretion. Reabsorption and secretion are opposites, right? If you happen to go from the peritubular capillaries, which is the bloodstream, and you're going into the nephron, that's called secretion. If you are going from the nephron and you're going back into the peritubular capillaries, we call that reabsorption. And then we have a very specific name. We call this, whenever there's material flowing from the glomerulus into the Bowman's capsule, we call that filtration. And how fast material flows from the glomerulus into the Bowman's capsule, or how fast stuff is filtered through the glomerulus, we have a term for that. We call this the rate of filtration. In fact, we have an even more specific name, a clinical name. We call this the glomerular filtration rate. Some of you may have heard of this as GFR. And in the next video, we're going to talk about what actually affects GFR.